the Managing Director of the International Monetary Fund. Welcome, my sister. Kristalina will say more in a few minutes about the economic impact of the pandemic and what the IMF is doing to support countries and the global economy. More than 1 million confirmed cases of COVID-19 have now been reported to WHO, including more than 50,000 deaths. But we know that this is much more than a health crisis. We're all aware of the profound social and economic consequences of the pandemic. The restrictions many countries have put in place to protect health are taking a heavy toll on the income of individuals and families and the economies of communities and nations. We're in a shared struggle to protect both lives and livelihoods. In the short term, countries can ease the burden on their populations through social welfare programs to ensure people have food and other life essentials. For some countries, debt relief is essential to enable them to take care of their people and avoid economic collapse. This is an area of cooperation between WHO, the IMF, and the World Bank. But ultimately, the best way for countries to end restrictions and ease their economic effects is to attack the virus with the aggressive and comprehensive package of measures that we have spoken about many times before: find, test, isolate, and treat every case and trace every contact. If countries rush to lift restrictions too quickly, the virus could resurge and the economic impact could be even more severe and prolonged. Financing the health response is therefore an essential investment, not just in saving lives, but in the longer-term social and economic recovery. There are three main areas for countries to focus on. First, we call on all countries to ensure core public health measures are fully funded, including case finding, testing, contact tracing, collecting data, and communication and information campaigns. Second, we also call on countries and partners to strengthen the foundations of health systems. That means health workers must be paid their salaries, and health facilities need a reliable supply of funding to purchase essential medical supplies. Third, we call on all countries to remove financial barriers to care. If people delay or forgo care because they can't afford it, they not only harm themselves, they make the pandemic harder to control and put society at risk. Several countries are suspending user fees and providing free testing and care for COVID-19, regardless of a person's insurance, citizenship, or residence status. We encourage these measures. This is an unprecedented crisis which demands an unprecedented response. Suspending user fees should be supported with measures to compensate providers for the loss of revenues. Government should also consider using cash transfers to the most vulnerable households to overcome barriers to access. This may be particularly important for refugees, internally displaced persons, migrants, and the homeless. The pandemic is also having an effect on the fight against other diseases like polio. As you know, in recent years, we have driven polio to the brink of eradication. This has been a massive global effort, started by Rotary, supported by many other partners, and led by thousands of health workers, vaccinating children in some very difficult and dangerous areas. Many of those health workers are now supporting the COVID-19 response. They're tracing contacts, finding cases, and providing public health information to communities. To reduce the risk of increasing transmission of COVID-19, the Polio Oversight Board has made the hard decision to suspend house-to-house vaccination campaigns, knowing that this may lead to an increase in polio cases. To reduce this risk, we will support countries to maintain essential immunization for all vaccine-preventable diseases. WHO has published guidance for countries on how to maintain essential health services even while responding to this crisis. The Global Polio Eradication Initiative is working to ensure that once it's safe to do so, countries can be supported to rapidly restart polio vaccination campaigns. While all our energy may be focused on COVID-19 now, our commitment to eradicating polio is unshakable. Sadly, there are reports from some countries of an increase in domestic violence since the COVID-19 outbreak began. As people are asked to stay at home, the risk of intimate partner violence is likely to increase. Women in abusive relationships are more likely to be exposed to violence, as are their children, as family members spend more time in close contact and families cope with additional stress and potential economic or job losses. Women may have less contact with family and friends who may provide support and protection from violence. We call on countries to include services for addressing domestic violence as an essential service that must continue during the COVID-19 response. If you're experiencing or at risk of domestic violence, speak to supportive family and friends. Seek support from a hotline or seek out local services for survivors. Make a plan to protect yourself and your children any way you can. This could include having a neighbor, friend, relative, or shelter identified to go to should you need to leave the house immediately. There is never any excuse for violence. We abhor all violence of all forms at all times. Finally, the global response to COVID-19 would not be possible without the generosity of countries and partners. 2 months ago, WHO issued its Strategic Preparedness and Response Plan with an initial ask of $675 million to support the response. I'm delighted to say that almost $690 million has now been pledged or received. Of this amount, $300 million has been given to support WHO's work, and the rest has been given on a bilateral basis or to other organizations involved in the response. I would like to thank the State of Kuwait, which today is becoming one of the largest donors with a total of $60 million US. Separately, WHO Solidarity Response Fund has now raised more than $127 million US from more than 219,000 individuals and organizations. I would like to thank Tencent for its contribution of $10 million US. I'm also pleased to announce that I have invited UNICEF to join the Solidarity Response Fund. UNICEF has extensive experience both in fundraising and implementing programs, and our partnership will help us to work together closely to save lives. And thank you so much, my sister Henrietta, for accepting my invitation. We still have a long way to go in this fight. WHO is working every single day with all countries and partners to save lives and to mitigate the social and economic impact of the pandemic. The IMF is a key partner, and I would now like to hand the floor to my sister, Kristalina, to make a few remarks. And thank you so much for joining us, Kristalina. Thank you.
Thank you very much, Dr. Tedros, for the invitation, but most importantly, for the work you and your staff do. And I want to express from the bottom of my heart a gratitude to all health workers that are on the front line to save lives, sometimes risking their own. At the outset, I would like to make 3 points. First, this is a crisis like no other. Never in the history of the IMF we have witnessed the world economy coming to a standstill. We are now in recession. It is way worse than the global financial crisis. And it is a crisis that requires all of us to come together. WHO is there to protect the health of people. The IMF is there to protect the health of the world economy. They both are under siege. And only united we can do our duties. I want to stress the message that you and I have sent to the world, that saving lives and protecting livelihoods ought to go hand in hand. We cannot do one without the other. And in that spirit, we at the IMF are concentrated on making sure that there is a strong response to the health crisis, as well as protecting the strength of the economy. My second point is about emerging markets and developing economies. They are hard hit, and they have very often less resources to protect themselves against this dual crisis, health and economic crisis. We know that in many countries, health systems are weak. We know that in flight to safety, a lot of capital has left the emerging economies, the developing world. Nearly $90 billion have flown out. This is way more than during the global financial crisis. And some countries are highly dependent on commodity exports. With prices collapsing, they're hit yet again. It is paramount for us to place these countries, and especially the weakest among them, in the center of our attention. The same way the virus hits vulnerable people with medical preconditions hardest, the economic crisis hits vulnerable economies the hardest. And that takes me to my third point. We at the IMF are mobilizing strongly, working together with the World Bank and other international financial institutions, bringing the world together to provide protection against this crisis. We have $1 trillion war chest, and we are determined to use as much as necessary in that protecting the economy from the scarring of this crisis. We are mobilizing emergency financing assistance to countries, and I can tell you we have never seen ever such a growing demand for emergency financing. Already over 90 countries have been placing requests to the IMF for it. And this emergency financing is to underpin the appeal that you and I are putting out. And it is, please prioritize health expenditures, use money to pay doctors and nurses, make sure hospitals function, that there are makeshift clinics where necessary, and protect your economy, the most vulnerable people, firms, so they can hold on their workers, because the highest risk we see is a wave of bankruptcies and layoffs that would make the recovery from this crisis harder. Third, we, in this line of financial support, we have the big one, 1 trillion. We have the emergency financing. We are also taking strong action for the poorest of our members by mobilizing grant funds to serve their duties to the IMF, so they don't have to use scarce resources today for that purpose. And together with the president of the World Bank, we put out an appeal to official bilateral creditors for the time the economy is standing still to have debt service obligations also in standstill, a moratorium on debt service for either countries. Let me finish by saying that this is, in my lifetime, humanity's darkest hour, a big threat to the whole world. And it requires from us to stand tall, be united, and protect the most vulnerable of our fellow citizens on this planet. Thank you. Thank you, Tedros, for having me.
Thank you very much, Ms. Georgieva, for this very remarkable speech. Thank you, Dr. Tedros. We will now open the floor to questions. I would ask journalists to ask only one question, and if it's possible, to specify to whom this question goes. So we will start first with the CNBC and Dawn from CNBC. Dawn, can you hear us?
Hi, yes, can you hear me?
Yes, please go ahead.
Okay, thank you for taking my question. I am calling from quarantine in New York City. My question is that the fatality rates in Italy and the United States, especially Italy, are significantly higher than in Asia. And it appears that that may be the case in the next few weeks in the U.S. I've seen research reports on ACE inhibitors and ibuprofen affecting this disease. Is there anything in the diet, the lifestyle, the typical drug protocols that Americans or Europeans use that make this virus more severe?
I can begin, and Maria, I can follow up. Certainly the experience in Italy and a large number of patients were questioned on their use, for example, of ACE inhibitors, and there was absolutely no association on the use of those ACE inhibitors on having disease or not, or having severe disease, more importantly. So, and now, obviously, we need to gather more evidence, but the evidence thus far would indicate that these antihypertensive drugs that are used, many people are on, do not appear to have any impact on the severity of disease. With regard to the reasons why we have different mortality in different countries, a lot of it's mediated by two factors. One, the age profile in those communities. Populations that have older populations, or a higher percentage of people in the older population. It may not be that the overall case fatality is different, it's just that case fatality is higher in that older age group. Equally, the presence of underlying conditions in those individuals and the incidence of underlying conditions in those individuals can also lead to worse outcomes. So you have a lot of issues that have to be factored in when you try to work out why one country's mortality rate is higher or lower than another's. And obviously as well, and this has to be taken into account, that systems that come under huge pressure, systems that are overloaded with fatigued doctors and nurses, with many, many sick patients at one time, clearly the outcomes for those patients can be worse. That's what we've been saying, and many countries are trying to do. We need to take the pressure off the healthcare system. We need to reduce the tsunami of patients coming through the door to give doctors, nurses and other carers the opportunity to save more lives. We can only do that if we pressure the virus and put it under pressure, reduce the incidence, and get back to a situation where we can deal with this virus within the healthcare system in an effective way. Maria?
Thanks, Mike. The other reason why it's challenging to compare mortality rates is because, indeed, it is a rate which you're calculating on any given day. which means you are looking at the numbers of people who have died divided by the number of people who have been reported in that country. And so there are significant differences in terms of the activities that areas are doing to identify cases based on the epidemiology, based on the transmission scenario that they're in. And in many situations where systems are overwhelmed, they're focusing on severe cases, and those are the cases that are being detected, and you're missing mild cases or unrecognized cases that may be in the community. And so that could lead to a higher number of a mortality rate. At the same time, you have individuals who are still in hospital that are developing, either progressing to more severe disease, and some people who are experiencing severe disease will have advanced treatments. They could be on ventilation, they could be on ECMO, and it will take some time for them to either recover or to die. And so it is very difficult and misleading to be comparing mortality rates. What we really need to be focusing on right now are what is the age profile of people who are in ICU. We've talked about this before. We're seeing more and more individuals who are of the younger age group, in their 30s, in their 40s, in their 50s, who are in ICU and who are dying. Overwhelmingly, we do see a trend across countries that people who are older, people who have underlying conditions, will have more advanced disease. So if the population that is affected have those characteristics, then you'll have a higher risk of death. We have some time to go before we can really understand what mortality looks like across different countries. So I would urge you to take those mortality rates with caution when comparing across countries.
Thank you very much, Dr. Ryan and Dr. van Kerkhove. We will now go to Simon Ateba from Today News Africa. Simon, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, please go ahead.
Thank you for taking my question. My name is Simon Ateba from Today News Africa in Washington, D.C. And my question goes to the Managing Director of the IMF, Ms. Kristalina Georgieva. From Lagos in Nigeria to Johannesburg in South Africa, and even to Kinshasa in the Democratic Republic of Congo, Africans who have been forced to stay home are complaining about hunger. Many of them say that hunger may kill them faster than even the coronavirus. The WHO Director General recently said the IMF and the World Bank should grant debt relief to developing countries, including African countries, to provide food to their citizens and curb the spread of the coronavirus. Can you guarantee here today that you will pay special attention to African nations to contain this pandemic by granting debt relief to African nations before it's too late? Thank you.
Well, I want to thank very much for this question. It is the continent we at the IMF worry a lot about. There has been a momentum built in Africa. Africa has been growing, and many countries have done really well in recent years, and we are risking to lose this momentum and even worse, to reverse it. And therefore, it is hugely important to provide substantial financial support to Africa. And we do it in two ways. One, we are scaling up emergency financing. And I can tell you that yesterday our board approved emergency financing for Rwanda, and today 2 more African countries are going to be in discussion for approval. Our objective is to double what normally is being provided as emergency financing, and we do that in very highly concessional terms. With a big component of this financing being de facto grant component. We do so because we recognize that many governments are faced with this dilemma. Do they provide support to people to simply survive? Do they fight the virus? And we want this to be a false dilemma. We want them to have, for the next months, substantial financial resources so they can step up their support for people against the pandemic and their support for the economy, in many cases informal economy that requires social safety nets to be strengthened to help people. Two, we do see the issue of debt as one that has to be addressed urgently. For us at the IMF, what it means is that for our poorest members, we are raising grant financing to cover their dues to the IMF. It is called Catastrophe Containment Relief Trust, and we have been getting support from the UK, Japan, and others, so we can do what you're saying, provide that relief vis-a-vis our own obligations. Beyond that, we are also calling on official creditors to countries, either countries, many of those are countries in Africa, to provide much needed space for countries to address their immediate priorities by a standstill on debt service to official creditors for a period of 1 year. And I can tell you that I have been in touch with many of the leaders in Africa. I know how important it is right now to stand up and support Africa, build a bridge over what is such a dramatic drop in their economic performance.
Thank you very much.
Listening to a briefing from the World Health Organization headed by Dr. Tedros Adhanom. He's hosting a panel there, which also featured, importantly, Kristalina Georgieva, who's IMF chief, and she talked of this dual crisis that's health and economic. And in history, we have never witnessed the world economy come to a standstill. She said that in her lifetime, this was humanity's darkest hour, saying that developing economies are the hardest hit and we need to focus on those countries, and also talked about a war chest, which we'll come on to now with James Bays, who's been listening in, our diplomatic editor, of course, at the United Nations. And James, what about this war chest? So $1 trillion has been earmarked.
Thank you very much for this question.
Well, that's what she said is going to be needed to solve the problem, and she is a very sober economist and stateswoman, been in charge of the International Monetary Fund for only 5 months. She took over from the French woman Christine Lagarde 5 months ago, but she has a great deal of experience. She's a Bulgarian who previously was a European commissioner. Now, she showing, I think, the enormity of this crisis. Remember that her organisation, the International Monetary Fund, was set up along with the World Bank, the so-called Bretton Woods organisation set up at the Bretton Woods Conference at the end of World War II to try and get the world's economy out of World War II. Well, she's saying this is an even tougher task, certainly much greater than the recession of 2008 and 2009. So she's, I think, showing the scale of the problem. And in that last answer, I think she's showing where she's most worried, which is the developing economies of the world, particularly in the end, in that last answer, focusing on Africa, a place she said economically had showed so much momentum in the last few years, but momentum that could be seriously set back by what we're seeing from this virus. What we see at these World Health Organization press conferences is a daily update of the situation with coronavirus, but regularly they have guests in from other parts of the world community to focus on the various impacts. Kristalina Georgieva making it clear that, in her view, you have to deal with the lives, saving the lives and saving the livelihoods simultaneously.
Right, and Dr. Tedros, the WHO chief, talking of the knock-on effect of this terrible crisis and how it's affecting other diseases like polio.
Yeah, well, clearly, if you've got all this medical attention focusing on the virus, then all the other attention that would normally be there, people who would normally go to hospital in developing countries, as you say, things like polio, the efforts, the public information campaigns, all of these are affected because of the efforts that's going on to deal with the virus. And clearly, what is most worrying, and worrying here at the United Nations, and we heard the UN Secretary-General, Antonio Guterres, a couple of hours here at UN headquarters in New York. Remember, the World Health Organization is part of the UN. They are worried that the most vulnerable communities of the world are the ones that probably don't travel the most. And so it's actually been the developing world with the most sophisticated medical systems that's been hit first. But they're worried that the more vulnerable areas, the developing world, conflict zones and the like, they may be down the line. And that's why the UN is trying to mobilise a major effort to try and protect those communities.
All right, James, thanks very much. James Bays at the United Nations. I'll tell you what, let's just dip in again and listen to Kristalina Georgieva, the IMF chief, who's speaking right now. Actually, it's gone back to Dr. Tedros, isn't it, at the panel? But let's listen in anyway.
Occasions to ask a question. Hello. So we will try this time, please.
Yes, can you hear me?
Yes, go ahead.
Okay. So can I ask you what's the WHO stance on antibodies testing? Have you already approved some of them? And is that a good practice that we widely use tests for antibodies before the lockdown is actually over? And of course, the immunity passport also. Is that a good idea that comes from Germany, I think? Is that feasible for countries such as Italy? Thank you.
So thank you for the testing. There's a very large number of molecular tests and serologic tests that are now available for use, some of which have gone through approvals in their countries, regulatory approvals. We are working with a number of countries right now that are looking at the use of serologic assays in the form of research, where they are looking to estimate the seroprevalence or the antibody levels in populations in their countries. There's a number of countries across Europe and across Asia that are currently doing this, and they're looking at different types of tests. They're looking at screening assays, which are ELISAs, but they're also looking at microneutralization assays, which are more confirmatory testing. There is a large amount of work right now, and we're working with FIND, and we're working with other groups that are trying to evaluate these against a well-characterized panel of sera from infected individuals and non-infected individuals or controls, and that work is still underway. What we would like to be able to do in the form of research is to be able to compare some of those serologic assays with individuals who are known to have been infected, so identified through molecular testing. And all of this work is underway. But there are a number of tests that are available, and this is very positive in terms of being early 4 months into a pandemic, where they were rapidly developed because full genome sequences were shared very quickly by China.
Just add, the tests that are currently being used are PCR-type tests that detect the virus, and usually in the nasal cavities of individuals. So if someone is symptomatic and they get tested, you test for the virus. The serologic tests don't test for the virus, they test for the immune response to the virus. And they say you've had a recent infection or maybe not so recent infection. And there are different parts of that test for IgM, which tells you if you've had a very recent infection or still infectious, and IgG, which says you've had an infection at some time in the past. So we have to be careful in using these tests that they may diagnose you as having had the infection, but they're not necessarily used in the active diagnosis of an active case. You can be sick and infected with the virus, and you may not have yet developed a serologic response to the virus. So how these tests are used has to be very carefully calibrated. We welcome all the innovation, and we need a comprehensive set of testing tools, but they need to be rolled out with the careful objectives of what they're actually supposed to achieve. But we do welcome the innovation, we welcome the private sector innovation, and we welcome governments introducing these testing into their national policies in the appropriate way.
Thank you very much. We will go now to Agnes, our colleague based here in Geneva from AFP. Agnes, can you hear us?
Yes, hello, Tariq, I can hear you. I wanted to add a question to something that Maria Kerkhoff said before. She said, if I understood well, that more and more, it appears that more and more young adults are in intensive care. If she can give us some figures about that, and if she has any explanation. Thank you.
So thank you for that question. Yes, indeed, we are seeing more and more younger individuals who are experiencing severe disease. I should say overall, most of the people who are experiencing severe disease and ending up in ICU and needing advanced care are people of older age and are people who have underlying conditions. But what we are seeing in some countries is that there are individuals who are in their 30s, who are in their 40s, who are in their 50s, who are in ICU and who have died. We've seen some data from Italy, we've seen some data from China, we've seen some data from a number of countries across Europe where people of younger age have died. Some of those individuals have had underlying conditions, but some have not. And so what we need to better understand is why there are young people who are dying from this infection. There are still many unknowns at the present time, so I can't give you a complete answer on that. But what is important is that people who are infected with this, even if they have a mild disease, what is classified as a mild disease or a moderate disease still includes pneumonia. And if you hear anyone who has been infected, who explains the kind of disease that they've had, it's still pretty significant, even if you don't require hospitalization. But what we need to better understand, and these will come through these natural history studies, which are being conducted, of why are some people progressing from moderate disease to severe disease to critical disease? Why are some people...
That's the picture in Geneva, the World Health Organization, hosted by Dr. Tedros Adhanom, also featuring the IMF chief, who said that in her lifetime this was humanity's darkest hour, and it's a crisis like no other, and never has they witnessed the world economy come to such a standstill. More to come.
Full of struggles, full of pleasure.
Sí es cierto que a veces buscar recursos es complicado con las condiciones que todo el mundo sabe que existen en Cuba. Yo no necesito grandes cosas para ser feliz. Necesito estar rodeada de las personas adecuadas, eso sí.
An intimate look at life in Cuba.
Mi Cuba es mi familia, es mi trabajo, son mis proyectos. Mi Cuba es el único lugar donde consigo la vida.
My Cuba on Al Jazeera.